Alright, now see this. Now can you see, this is not a forceps, okay, this is a scissor. Now it's a typical kind of scissor. Can you see, it is not looking like a normal scissor we have. So this is actually a spring scissor. It is a conjunctival spring scissor, and as far as the tip is concerned, we can have a sharp tip or a blunt tip. Now, why this is called a spring scissor? Spring scissor means this scissor is working with a spring. So, can you see here? Can you see here? The blades are actually apart like this. Why? Because there is a spring action. So, when we are actually cutting the conjunctiva, see, for making the flap, you require that spring action, otherwise it will be becoming very traumatic kind of dissection when you want to make a conjunctival flap. And so it's use. See, in order to cut the conjunctiva for making the conjunctival flap. So for this, you already know that what are the steps of the cataract surgery. This is the first thing that we keep on learning while we are doing the lens and the cataract, that first you have to make the incision, corneoscleral incisions, and for making that you have to do the cutting of the conjunctiva. So now you can correlate. For this I require spring kind of action, right? For that it will be easier. Like for example, if you remember in our first years when we used to do the anatomy dissection, some amount of dissection that was called as a blunt dissection was done by our fingers only. So can you see, this is again a spring kind of action that we used to do for the blunt dissection. So in eye, the blunt dissection obviously cannot be done with the help of a finger. So here we are using this conjunctival spring scissors. So if you remember its name and if you see its tip, this moment you see the open tip, you will remember that it is like this. That is the spring action. Alright.